Minister of Health, and the Deputy Minister is somebody else she meets with pretty regularly. So she sits at some of those tables where some really important decision making is done. And so with, she might say, Verna, because she's the CEO of Alberta Health Services, she says, oh yeah, I'm going to call Verna. I don't call Verna. That's Verna. But she does meet with those people, and it's her job to do so. And so what we hope is that we can hopefully address the advocacy at those different kinds of levels, okay? So we are not the kind of office that can, because if we had 100 people in our office, we'd send someone out here, you know, on Tuesday when you have that bad experience to actually go with you and take you over to the ER and go with you and advocate with you. We're not that because we don't have enough staff, but we're also not that because we believe that our jobs are to empower our clients. So that if I help you today to communicate in a way that is most effective with your doctor's appointment tomorrow, that if next week you go to a physio, you can use some of those skills. And then heaven forbid, if it's the week after and you have to advocate for your kid in the school system, maybe you've learned some of those skills too. Cool. And if you have to fight on your phone bill, fantastic if you can use some of those skills there too, right? So hopefully, so not only are we not staffed enough to go take you by your hand, but we also believe in terms of our philosophy of our office, that what anybody really wants us to be is as independent as possible for as long as possible in their lives. That's what they want. And that really healthcare should be client-centered. It should be. It should be about the individual need of the person. So we try to work that way in our office too. So I'm going to keep going. That's all you get to know about Kathy.
Can you say that again?
So this is a little bit of history.
Kathy.
Can you say that philosophy again?
Maybe.
That's asking a lot.
Whoa! Okay. So what did I say? I think our office believes that healthcare should be client-centered. So it should be meeting the needs of the client or the patient, if you want to call them a patient, or people-centered, the person. And so we try to run our office in the same kind of way. And we try to do our help to those people who call us in that same way.
And the piece that you said earlier was you want them to be independent as long as possible as well.
To be as, I think all people want this. All people in the whole world want this. To be as independent as possible for as long as possible in my whole life. Isn't it? As independent as possible.
As independent as possible. Okay.
For as long as possible.
For as long as possible. Sounds like a wedding vow.
In my whole life.
You're going to write that down. So.
I do. No, death do us part.
For as long as possible.
For all of my life.
For all of my life.
And I think that's just how people want. So history-wise, our office, so about 30 years ago, our office was created at first, and it was created around the Mental Health Act, and we're going to talk some more about that because Ryan is our expert on that. He knows way more than me about the Mental Health Act. I'm still catching up. So, and that was a time around across the country that people were saying, holy smokes. So we have the Charter of Rights for all Canadians. And it says a whole bunch of stuff, but you know what? When we detain people in a facility to treat for mental health issues, we take some of those basic human rights away. We do. So around that time, many of the provinces were saying, we better put something into legislation that says you still have some rights. Even though we've said we're going to keep you in hospital, you have some rights. What are they? So they created this legislation, and as part of that legislation, they created the Mental Health Patient Advocate. Okay, so that existed over here. And about 4 or 5 years ago, then we had the creation, and Renee shared it with you, the Health Act and the Charter, and then we had the creation of the Office of the Alberta Health Advocates. So Mental Health Act, Mental Health Patient Advocate deals mostly with rights, care and treatment, and ensuring those rights are upheld. Okay, uphold those rights, make sure they're enshrined, they stay right there. The legislation for the health advocate's a little bit different. It says, if people have complaint or concern, you need to refer them to the right place to deal with that. So don't duplicate services. So if, say, it's a complaint about a doctor, we send you to CPSA, College of Physicians and Surgeons. That's who disciplines doctors. Okay? If it's something that happened in an Alberta Health Services facility or program, then it should go to Alberta Health Services Patient Relations. And we hope to have someone here today to talk to what that is, but they're not. So I'll tell you a little bit about them too. So there's the referral piece. We also, sorry.
So you have the mental health advocate and what was the second?
Health advocate.
Health advocate.
So then we can also navigate. So that's helping you find your way around the system. So navigation can be as simple as I'm phoning up and I'm saying, I live in Lethbridge, I live in Fort McMurray, I live in Camrose, and I'm looking for in some community mental health programs. And we'd say, well, you know, you can call your local CMHA and blah, 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 blah. It can be that easy. This is how you get there. More often, it's more to figure that out, right? So sometimes what we do is getting into really educating how that program works or how the system works and how you get there, not necessarily on who gives me the referral there, but what should I say? How should I say it? What questions do I ask? What's the best way of going about that? So it's kind of navigation on a simple basis, but also on a more in-depth basis as well. So we do that, lots of coaching, that kind of stuff as well. We can also, under the health legislation, the health advocate legislation, we can also do what's called a review, and we haven't done one yet. And it's based on the fact that, and this is something that would be very interesting to look at as we grow as an office, to see if we can get there. If you felt like the health charter was something that wasn't being upheld, it might be something like a big human rights case. It might be something that's a big Health Act case, right? A charter issue. And so we're still a very new office, and so that may come. So it would likely be something that the advocate herself would say, we're seeing this pocket of the health system that really needs an in-depth look. We're going to do a really in-depth look there. Something like that. So here we have the mental health patient advocate. Here we have the health advocate, and we put them in the same office, physically in the same office. But they only kind of overlapped this much, but they stayed this much separate. Which kind of didn't make a whole lot of sense if what we're going to do is be client-centered. So we said, so why should one day I call you and talk about community programs and find out how to get here and here? And then another day I'm in hospital, held and detained in hospital having treatment, and I'm calling you, but you're in the same office, and you're the one who's going to give me the information about the rights. Now, why couldn't I get that from you? So what we did was we said, okay, we're going to cross-train everybody. That's what we're going to do. So essentially, there's two pieces of our office, and then essentially there isn't. So those kinds of things all happen in our office. So reporting structure, we talked a little bit about this already. So does everybody understand the difference between Alberta Health and Alberta Health Services? Go like this if you do. Yeah. Watch my face. Okay. Okay, so remember I said, even those of us who work in the health system don't even know it? That's why. Okay, so here's the ministry. Let's pretend they're buildings. This building over here is the Ministry of Health. And that's where the minister, she's there. So she says to the ministry, you guys really should be mostly in charge of doing policy development, legislative development, and policy development in health. But there's a few bits and pieces within the ministry building. Well, we're actually a separate building, but that's okay. There's a few separate pieces that are actually operational, and we're one of them. We do operational work, active work every day. We're not making rules. Then there's Alberta Health Services. They are essentially our health providers, or one of our health providers in the province. So the biggest health provider. So we are actually, our office, we actually work for the Ministry of Health. We don't actually work in the same building though. So in Edmonton, the Ministry of Health building, almost everybody who works in health ministry, works in that building. We don't. We work about 6 blocks away. They also have access to a lot of the same information to each other. We have a separate database. We don't share it with them. We keep our information confidential. So although it says we're at arm's length, we're kind of only at elbow's length from them. It's not quite a whole arm, because they still pay our paychecks, right? Yeah,
So you have Alberta Health Services, and what was the one prior?
Alberta Health. So just to confuse you,
Just Alberta Health.
a few years ago, and all of us, really, they just decided to call it Alberta Health and Alberta Health Services. It actually happened when we changed over a number of years ago. If you remember, the Stephen Duckett era, who was in charge of Alberta Health Services, that whole era, they said we need to separate these out. Most provinces, it's one and the same. The health ministry does all of it. In our province, we separate it out. The policymakers and the operational people. Policymakers plus a few bits of operations, and we're them. Okay? So that's kind of what it looks like. This is mission, vision, values. You know, we're swell. Pretty much. You know, it's a corporate thing. You got to have the mission, vision, values. It kind of gives you direction, all that kind of stuff. You can read that on your own.
Just a question on that,
Yeah.
is that a good thing that you're separate, or?
Alberta Health from Alberta Health Services, kind of, sort of, not really, no.
Excuse me, sir, garbage.
Just outside the door.
Okay, so let me tell you some of the issues about the differences between Alberta Health and Alberta Health Services. You can check this with the minister. The minister is still the boss of both. I'll tell you some of the issues around it. Sometimes it's really good because Alberta Health Services then has to be responsible for what Alberta Health Services does. Sometimes it's really not so good because Alberta Health will say, well, that's not us, it's Alberta Health Services, and that's a whole different thing. And then Alberta Health Services will say the same thing, that's not us, that's Alberta Health, and they're the funders, and that's where the problem is over there, right? And so you get that happening there. Then you also get a little thing between Alberta Health and Alberta Health Services, right? We want to be more the bosses, we want to be more the bosses, and neither one is really told they're the bosses. So you get that stuff going on too, right? And sometimes it's good, it's really good for us, because we are kind of elbows length. So we sometimes when Alberta Health Services is not really happy to see other people from the ministry, we're still okay. And sometimes the people in the ministry, when they're thinking, ooh, it's the advocate's office, we can say, oh yeah, but we're Alberta Health employees. So for us, in some ways, it's very good. So we can kind of,
Sit on the fence.
sort of, yeah, kind of, we can kind of, there's definitely some form of sense there. So, yeah, fence in a sense, yeah, never mind. Anyway, so yes, there's some days where you think, oh, it's not so that we're separated like this. And other days that you think, no, that's very good. And sometimes during the day you think, I don't know. But we learn how to work within the function of the system, yeah.
Renee, could you email us her presentation
Yes.
and your PowerPoint as well?
Absolutely.
That'd be good.
Good,
Because
okay.
you're giving us information, but it's not retaining and not.
Okay,
You know what I mean?
sorry.
Like, if I see it, because for First Nations people,
Yeah.
we're visual learners.
Exactly.
We're not, we can't like read a book or listen to someone and it's not gonna retain, so.
And so I also want to tell you that it's okay if you don't. If you come away with this today and you have a few real nuggets, we're thrilled. And you can always call us, that's what we're about. And we want you to call us, and we want you to have anybody that you come in contact, call us. And it's okay to phone, we're one of those.
Presentation is right. in
Oh,
your-
yeah.
It's in the packet.
Oh.
We're one of those kinds of offices that says, if you need us again, call us back. Please call us back. It's okay to call us again. So we're kind of weird in that way. We like it. We like being that weird. Saying to people, call us again, please. That would be nice. Thank you very much. You know, call it when it, yeah. Or if you know someone else who wants to go do that too. That's very good. So it's okay. It's also okay to call us and say, I'm not sure if I'm calling the right place, but can I tell you the story? We're very good at that. Our staff are very, very good at that. So that's okay too. So if you walk away from here today, you have a piece of contact information from us, and you know kind of sort of what we do, and have a couple of nuggets, we're thrilled.
I called you guys and yeah, you told me, okay, here's the story, I told you the story, then you said, okay, this is the step that you have to take then. Yeah, and if that doesn't help, then call us back. But I did it myself, so.
Thank you.
What's your advice though?
Thank you.
Not, but I don't think I would talk to you.
I don't think you
but-
talked to me, but I'm glad somebody told you that. It worked! I'm thrilled. So, remember I was saying, there's me helping you on a frontline basis. But we know that there are some real issues that happen that are common to many people. And it's about the health system, and it is a systemic change that needs to happen. And those things we can be elevating and taking to tables. You know, Kathy meets with the head of the CPSA, College of Physicians and Surgeons. She meets with them. Every few months she meets with them. She can talk about those things. She can say, you know, we're here and the doctors aren't doing this, or they are doing this, or we're happy they've finally changed and doing this. She can have those kinds of discussions. But it's important that we start listening to what those big issues are. The other thing that gets raised too are some of, you know, sometimes something happens in the health system, it only happens once, but holy smokes, you go, how could this possibly be happening in my country, in my province, in this day and age? This is ridiculous. So just because you may be one of many who are complaining about that, that's not the only time those issues get raised. We also are raising and discussing those issues that may be those one-offs that are just, it should never have happened. So these are some issues, and you can have a look at them too. They are in no way all of the issues that we hear. So when Kathy came in January, she said to me, or July, she said to me, you know that thing we were talking about the other day, there was a couple of issues that you were saying, well, there's that and that and then that, and I said, yeah. She said, you know, could you put a couple of them on my wall over here so that like I'm on the phone or I'm typing away, I can look up and see there's like a couple of health issues that are not going so well in our system. And I said, you want some of those really? And she said, yeah. And I said, oh, I can do better than that. So she then got pages and pages of big flow sheets of information about where we are seeing issues, so that she could really understand what we're hearing on a daily basis. So I want you to know that just because you may call about your individual issue, that you may also be a part of something like this.
This maybe has nothing to do with it, but it's like you're part of Alberta Health.
Yes.
Right?
Yes.
You're basically the money or the theory.
Yes. Well, the money and the theory, and yeah, the rules around it, sort of.
Okay.
Kind of.
What happens, like, say, all your applications now, and the government changes?